The Food and Drug Administration has canceled an annual advisors meeting to weigh in on yearly updates to the flu vaccine, raising some concerns among experts about next year's flu shot. The committee was scheduled to be March 13th. In a statement Thursday, the Department of Health and Human Services confirmed the meeting was canceled and said the FDA will publicize its recommendations in time for updated vaccines to be available for the 2025-2026 influenza season. It comes after flu cases spiked this past winter, according to the CDC. Between last October and this February, there have been up to 910,000 flu hospitalizations in the U.S., up to 92,000 deaths. CBS News chief medical correspondent Dr. Jon LaPook joins us in studio with more. Doctor, what is the normal process for approving the vaccine, and are you also optimistic that the correct strain will be in time for next year's season?
Yeah, well, you have to sort of get ahead of it by about 6 months, because what's circulating now, usually often in the southern hemisphere, they have winter when we have summer and the other way around. So they have an earlier flu season. So generally, there is a meeting of the World Health Organization. In fact, it's taking place tomorrow in London. And attendees include the members of the committee that represents or that's advising the FDA, and also often people from the CDC. And what's happening now is that conference is going on, but the FDA, which normally would be attending, they said, we're canceling the meeting that's going to be happening here based on I guess, the new recommendation that, the United States is pulling out of the WHO, and there's sort of an uneasy and unclear relationship now in terms of the FDA and the CDC and the WHO.
Is it possible that the new flu strain will be decided without the advice from this panel?
Yeah, I think that is going to happen. What would normally happen is that the FDA would have this meeting, and it was going to be in March, and they would take what happens in the meetings tomorrow and the days around that and use that to help choose the strain. That's an open public meeting that the public can look at on television and then see. Completely open. And instead, what is probably going to happen, and Dr. Paul Offit, who's a member of that FDA committee, said today in an interview, he said, it's probably going to still be decided, but behind closed doors by the FDA. So, I mean, it's ironic because, one of the things that RFK Jr. said is he wants everything to be open and more transparent, and yet it sounds like this is still going to be chosen, because I got a memo today. I've been reaching out to the FDA and saying, come on, tell me what's going on. And I pushed them today, and I got back sort of like this form thing saying the meeting was canceled, but there's going to be no delay in the preparation of the vaccine. The vaccine's going to be ready for the next season. So that says, well, it's probably going to still happen. Dr. Paul Offit said, yeah, it's probably not going to be delayed, but that's got to mean that the FDA is going to do it without input from this advisory committee or from, the CDC potentially.
So clearly not business as usual. What do you think is going on here?
It's not business as usual, and I think that's the big point here is that, it's very disconcerting for a lot of us, including me. I normally have a very robust communication with the FDA and with the CDC, and my job isn't to guess what's going on or to be Nostradamus and say, I think this is what's going on. It's to hear them, take that information, translate it, put it in a level that people can understand. And what's happening now is I'm having to claw to try to get any information. We're interviewing Dr. Paul Offit, who is telling us, what he thinks is going on. And meanwhile, he was asked today, did anybody explain to you why this happened, why this FDA meeting was canceled? Or any logic? And he said no, he doesn't know. So, I mean, that's not a good feeling at a time when there's been so much change. Like, why are these changes being made? Just give us an explanation. We're grown-ups.
Real quick before we let you go, why did we see an uptick in flu cases?
Every year there's a lot of variations. So there's anywhere from 9 million to 40 million cases of flu every year. It goes like that, and anywhere from 6,000 to 50,000 deaths. So it depends on the season. We know there's a lot of mutations. We don't know how good the mix is, the matches between the vaccine that's out there and the vaccine and the actual virus, how good of a match it was.
Since 6 months ahead.
Since 6 months ahead. We try and it mutates during the season, so there can be changes with that. But, we're going to have to wait and see. And in the meantime, you got to start this because it takes 6 months to grow this virus. When they choose the strains, you got to grow it up in eggs. And, like 100 million eggs are needed, something like that. And it happens over many, many months. And so it takes time. You got to make the choice and say, okay, these are the strains that we think are going to be predominant. Sometimes you're right, sometimes you're not right.
That's why time is of the essence now. Okay, Dr. Jon LaPook, thank you.